Good morning, everyone. Thank you for joining us. Can we get a confirmation if people can hear us okay? Feel free to type right into the chat box.
Great, thank you.
Perfect. Thank you, everyone, for joining us today. This is the Get Healthy San Mateo County City Profiles and Data Portal webinar. My name is Karina Chung, and I'm an epidemiologist from the San Mateo County Health System. And today I'm joined by my colleague, Shireen Al-Khazali, who is a senior manager for policy, planning, and equity for the Health Policy and Planning Program. Before we begin, I'd like to go over a few housekeeping items. First, all participants are automatically muted. If you have any questions, you can type them into the chat box, and all questions will be answered towards the end of the presentation. Finally, the webinar will be recorded and shared later this week. For today, we'll go over a brief introduction to the San Mateo County Health System and Get Healthy San Mateo County. We'll follow that with a overview of the Get Healthy San Mateo County data products and a demo, lastly followed by a question and answer section. And I'll now hand it over to Shireen.
Hi everyone, I'm Shireen Al-Khazali, and as Karina mentioned, I'm the Senior Manager for Policy Planning and Equity with the County Health System. I wanted to start with the slide that you're looking at because the health system is really large and it often does not, it's hard to understand where we fit into it. The vast majority of the health system resources are focused on treatment and ongoing support. This is the area that many of you will be familiar with and think about when you think about health, which is your clinics, your doctors, the medical center, and then with a focus on prevention, we also ensure that we have preventative services. So that includes your mammograms, your well visits for your children, that includes early screenings. We also do education. So for example, the health system, if you come in to see one of our doctors and you learn that you're pre-diabetic, we will have educational discussions about cooking and physical activity opportunities. Where we fit into the system, and that's Health Policy and Planning Program, as well as the Get Healthy San Mateo County initiative, is under the place and policy realm, which is at the very top. We're a small but mighty team, and we focus on ensuring that environments facilitate health and opportunities. Research shows that about 10% of your health, in fact, is dictated by healthcare, that the vast majority is dictated otherwise, and about 70% of that of your health is dictated by behaviors and the environments that you live. And if you imagine that environments and behaviors are related, then you recognize that the environment can either facilitate good health or poor health and help you make healthy choices or help you make unhealthy choices. So our work with Get Healthy San Mateo County and the Health Policy and Planning Program is to focus on making the healthy choice the easy choice. As an example of that, we'll work on ensuring there's sidewalks near schools and safety. We'll work on housing stability and ensuring that people that live in those houses have the opportunities to be healthy. Now, Get Healthy San Mateo County is an initiative that Health Policy and Planning implements. And it's a collaborative of community-based organizations, county agencies, cities, schools, hospitals, and community leaders working together to advance healthy, equitable communities in San Mateo County. The focus is to use policy change to prevent disease and ensure everyone has equitable opportunities to live long and healthy lives. When we went to the community in 2014 and asked folks, what is it that makes healthy, equitable communities? What we learned is that there are very similar elements, whether you live coastside, northern county, south county, you're in the school system, you're a low-income family, that most of us envision a healthy, equitable community similarly. We envision the same elements needed to create healthy lives. Those 10 elements are identified in our strategic plan that you can find on our website at gethealthysmc.org. When those 10 elements came up, then we went back and asked, what is most important to you, envisioning over the next 5 years, what are the priorities for creating healthy, equitable communities? And what we learned is that folks were interested in stable and healthy housing. They wanted complete neighborhoods with transportation options, safe walking and biking options. They wanted to be able to access food nearby. They wanted high quality education and healthy schools, as well as economic opportunities for their families. Those are the 4 priorities that Get Healthy San Mateo County has been focused on and supporting over the last few years, and will continue to do so in the upcoming years. This will be pivotal when Karina comes back on to share with you the data portal, because it is structured around these 4 community identified priorities. We have initiatives under each of these priorities that I won't go into now, but you can find more information on our website, and certainly get in touch with me or anyone of our team members that are identified on the website for more information. Then another thing I want to make sure to mention is the framework that Get Healthy works under. The reason this is important is that this is both a tactical strategy as well as a values-based strategy. So we work on place-based prevention, and you'll see this in Karina's data portal in that we focus a lot on the GIS maps. We show you where healthy options are available, where people are doing better, where the social and economic factors that determine people's health outcomes are more positive or less positive. So location matters, and we know that from many years of research that shows that where you live can dictate how healthy you are. So we work on place-based prevention. We partner with cities and local community-based organizations and leaders that know their communities best. We focus on health equity. The reason we do that is that even though San Mateo County has been identified across California as the 2nd healthiest county, only behind Marin County in overall health, when we dig deeper into the numbers, as Karina will show you, what you identify is that we have disparities in health outcomes. So health isn't divided equally among people. We have a lot of disparate health outcomes by race, by income, by place, and by education levels. So what we do here at Get Healthy San Mateo County and Health Policy and Planning is ensure that we focus our attention on health equity, think about where people need more support to be healthy, and focus our attention there where possible. We also do our work in collaboration and partnership with our collaborative members, whether they're cities, whether they're community-based organizations, or resident leaders. We do this because this is a huge agenda and we can't do this work alone. We need our partners. We're not an implementing agency under housing or economic opportunity or transportation or schools, in fact, so we have to partner with our local implementing agencies to see any of the outcomes we're interested in seeing. But in addition, we collaborate because we believe it's the right thing to do. We know that city managers understand how their cities are run. Community-based leaders who work in neighborhoods know their communities best. And so we want to make sure that we are starting with where people are, how and what they understand their community needs be, and what they hope for their communities and families. So moving on, I just want to share with you before I hand it over to Karina how we work with partners. So our collaborative is broad-based and focused on diverse issues and priorities. And how we work with our collaborative members and across our members are identified here on the screen in front of you. So one, we work on policy change. As part of our mission is how we advance broad-based health outcomes. As a reminder, there are big public health policy wins that have made enormous changes in how we understand our lives and what the social norms are. For example, a few decades ago, it was completely normal for you to get on a flight from San Francisco over to New York and have someone light up a cigarette next to you. That's completely seems strange now to do, but that is public health policy. We wanted to make sure that a broad-based policy was passed to ensure that everyone, regardless of whether you were sitting in the seat next to that person or the flight attendant working on that flight, had the opportunity to ensure your environments were healthy and free of tobacco smoke. We've also seen policies have broad-based wins like child safety seats. A few decades ago, it was completely normal to have children crawling all over you, to have have children sitting on your lap as you were driving. What we realized that research showed, data showed that was very unhealthy, that created safety issues for children, and children were dying as a result of it. And we created child safety seat laws and seatbelt laws, and those are now part of our social norms. So policy can have broad-based impact. While it takes a long time to pass, it can make huge, enormous changes for making the healthy choice the easy choice. We also work on urban planning in cities and on plans to ensure that our place-based efforts are evidence-based, and they are incorporated into how cities and communities are planned in the future. We provide funding to our collaborative members once a year. It's not a lot of funding, but it is a recognition that we are a strong collaborative and that community-based organizations are leading at the forefront of a lot of these community-based identified priorities, and we want to be respectful of their leadership and provide funding where we can. Research, that's been a strong point for public health. We have a lot of mechanisms from epidemiology to GIS to provide research in ways that are you're able to consume in practical ways. The vast majority of today's conversation will be about research, and you'll see Karina's Karina go through the data portal as a way of us democratizing the data and research that we have here in the health policy and planning team. It also relates to capacity building, because we hope the research will bring capacity to you and ensure that you have the data you need at your fingertips. We also will work directly with community-based leaders in cities to provide health-based rationale, share the data that we have, support leadership development around healthy, equitable communities. Again, we partner closely with our collaborative members and ensure that we're communicating our efforts and opportunities for others to engage in healthy, equitable communities. So we put out a once-a-month newsletter, which I hope most of you are subscribed to. If you don't, please join us at gethealthysmc.org. We'll also put out a publication. Most recently, we put out a publication on the top, the schools that are the least safe in the most in-need communities. It's a Safe Routes to School Equity Analysis that I hope you'll take a look at, amongst other publications. We also put out case studies of our partners' work in each of our newsletters, as well as a staff perspective, among other things. So now we'll go back to the research piece as I turn it over to Karina to really share with you how we want to make our research and the data that we have available to you at your fingertips. So with that, I'm going to turn it over to Karina.
Thank you, Shereen. One of the ways that Get Healthy San Mateo County conducts research in partnership with our stakeholders is to provide data resources. All of our data resources are available on the Get Healthy website at gethealthysmc.org/data. Our data products cover a wide range of areas across HVP's priority areas. They include housing, with indicators such as median rent, rent burden, affordable housing, commuting. We also have indicators under the neighborhoods area, which includes active transportation, bicycle and pedestrian collisions, access to parks, small businesses. We also have indicators in the school's priority area, which includes third grade reading proficiency, educational attainment, free or reduced price meals, as well as indicators under economy, which includes things like median household income, income inequality, and poverty. And lastly, indicators that fall under demographics, such as total population, age, race, and ethnicity. All of these data are available through two main products of Get Healthy San Mateo County. The first one being the data portal, which is a section of interactive maps and charts. And we also have the Healthy Cities SMC project, which is a collection of city profiles for each of the San Mateo County cities. These different data products are available here on the website. You can access them by scrolling through the website or also looking at the menu on the top left hand of your screen. One way to help explore the data resources available is to look at the Get Healthy San Mateo County Data Indicators, which is an Excel file that you can download that's available at the top of the data screen. This resource is intended to help you have more information about what indicators are available. The Excel file includes things like indicator definitions, data product types, maps, charts, years, and data sources. Here is a screenshot of the Excel file that you can explore. You can see that we have a list of indicators and indicator definitions. We have the data products, so whether the indicator is available in the school's data portal page or in the economy, whether it's available in the city profiles. And we also have a section that shows you if the data is available among what type of maps. It could be census tract, city, school district, or it could be available as a chart and how the data is segregated. You can also see what year and data source is available for each indicator. To help you explore the indicator list, you can use the different filter options by using the arrows next to each header column. By using the arrow, you can filter and sort the indicators. For example, if you're interested in looking at what indicators are available by race ethnicity, you can click on the filter arrow, and it will pull up a dialog box, which will allow you to sort the indicators or to check and uncheck which type of indicators you want. So in this case, you can uncheck the blank checkbox, and you'll see that only indicators that have race ethnicity data are listed. And once you explore the indicators list, you can go back and look at the data portal city profiles. This is an example of the healthy housing maps in the data portal. You can see at the top that we have indicators listed by tab, so it's one indicator per tab. And underneath that, you see a row of tabs that show what map and chart options are available for each indicator. You can also read more about the indicator by reading the overview, key findings from the map or chart, as well as data sources. And then each map has a legend, which will allow you to better understand what the map symbolizes and represents. And you can also click on the map for more data. By clicking on any geography in the map, you'll see a pop-up that has more specific data. And for even additional information, you can look at the link below the map and see what methods, limitations, and references are available. One thing I also want to point out, if you're looking at the map by city tab in any of the data portal pages, you also have the option of clicking out to look at Healthy Cities SMC, either in the text box on the left or in the pop-up box. By clicking on this link, it will take you to the Healthy Cities SMC page, where you can see a list of PDFs, one for each city in the county. Each city profile has a section that introduces Get Healthy San Mateo County and the importance of health equity. We also include an overview and more resources. And then the city profile is broken up into 5 sections. Each section, such as this one, demographics, has a table, which includes data where you can compare the city to the county. You can also view what the data source is, and then look at the link for more data. Other sections in the city profile include healthy housing, and you can see on this page that there's a map that compares the city to the county, and each priority area actually has a map that you can view. And additional sections include healthy neighborhoods, healthy schools, and healthy economy. I will now go to the website for a demo over how to use the data products. This is the Get Healthy San Mateo County main data page. On this page, you can see that if you scroll down, we have a list of all the different data products available. So each of the priority areas has its own page on the data portal. And we also have a page for the Healthy Cities SMC, All of these pages can be accessed either by scrolling through the page, using the menu on the left-hand side, or using the navigation bar at the top. You can also see here that there's a list for the indicators list download. Next, I'd like to show you the demographics data portal page. As we mentioned earlier, you can see that each indicator is sorted with one indicator per tab at the top. Indicators that don't fit all on the top are listed in this menu button, so you can see that there are additional indicators listed. And in the demographics story map, you can see we have indicators such as total population, people of color, individual race groups, as well as limit to English-speaking households. Next, I'd like to show you the Healthy Neighborhoods data portal page, where you can see we have indicators such as active transportation, daily vehicle miles traveled, bike and pedestrian collisions, access to parks, crime, and small businesses. On this page, you can see that we have an introduction to each indicator, which includes the indicator definition, key findings, as well as the data source. And in the map, you can click on the map and move around to explore. By looking at the map, you can look at the different spatial variation in each indicator. And each pop-up shows additional data. And you can also look at the legend at the top right-hand side to understand what the map represents. The next data portal page I'd like to show you is the Healthy Schools data page. And you can see our indicators listed at the top. And then one thing I also like to point out is our methods, limitations, and references section. By clicking on this link, you can see additional information about each indicator. For example, for educational attainment, you see a list of what methods were used to compile and or analyze the data, the limitations to keep in mind if you use the data, as well as references to provide more information on the topic area. The last data portal page I'd like to show you is the Healthy Economy page. Many indicators have multiple ways to visualize the data, which you can see by looking at the second row of tabs under each indicator. For example, under median household income, you can see that there are maps available by census tract as well as by city. And you can also click on additional tab to see what data is available as a chart. All charts are interactive. You can hover above each chart and see the specific data point. And then looking back at the maps, one thing I do want to point out is that if you zoom into the map or move the map around, the maps are linked so you can directly compare census tract to city. So you can see here that the city map is in the same extent as the census tract map previously. This will be helpful for people who are interested in looking at their city and want to compare sub-city differences by looking at the map. If you're on the city profile, if you're on the city map page, you can also click on any geography and click on the link to take you to the Healthy Cities SMC profile page. This is also available by looking at the text box on the left-hand side. The Healthy Cities SMC profile page is here. You can see that there's a list of PDFs for each city. And as we saw earlier, each city has an overview section and then data sections for demographics, housing, neighborhoods, schools, and economy. Next, we're going to open up to Q&A to see if people have any questions about how to use the data portal.
So please remember, this is Shireen Malik-Gazali. Thank you so much, Karina. Please remember that in the bottom right-hand corner, there's a chat function that you can directly type in your questions into. They can be as specific as a question on a map or something more related to how you navigate through the maps, the city profiles. Please don't be shy. Let us know if you have any questions. We want to make sure that this is a usable tool for you. The reason that we have made all this data available and fairly easy to navigate is because our hope is that you will come into this portal, you will peruse around, get the data, be able to get the data you need, print the maps that you need, utilize it in the way that you need. And just going back as a reminder for what Karina was sharing, we have two main pieces of our data portal. One is the actual data portal that includes over 30 indicators, and those indicators have been cut either by race, by place, in other disaggregated in other ways. We also have the city profiles that take any of the data that we have around the social and economic factors that determine health within a city and put them in a healthy city profile that includes healthy City of San Mateo, healthy daily city with the details there. So it looks like we have a question from Danielle. Thank you for writing in your question. Does the data portal include links to the original sources as well?
Yes, we do. If you go to the methods, limitations, and references page, there are links to the websites that we pull the data. The one thing that I do want to add is that all the data that's on the website is publicly available. It can be accessed by anyone. So while some of the data might just be simple downloads, which we then upload to our website, additional indicators do have some data analysis, which we can share to our partners who are interested.
I will share that we do have one data indicator up there, an index called the Youth Need Index that includes proprietary information about our clients and where they're located in the juvenile justice system that is not right now publicly available as I know it. I hope that answers your question, Danielle. Thank you for writing in.
So it sounds like, it looks like there's no more questions at the moment, but of course, we're always available to be contacted if people do have further questions later on. And I do want to remind folks that, Get Healthy San Mateo County is looking for opportunities and partnerships to engage with our partners, and we're open to connecting with anyone who's interested in this work.
Yeah. You still have time to put in your questions, so again, please don't be shy. As a reminder, this is just one way that we share the data at work. We have done research, much more tailored research in partnership with our collaborative members. One example is that we have worked with the City of San Mateo, the city manager's office, when they were considering minimum wage policies to really look at a profile for the population in San Mateo County that was making less than $15 an hour. We created a profile of who those folks were. We've also worked with the City of Daly City to look at diabetes rates. We've worked with community-based organizations, legal aid organizations to look at the relationship and look at the research between eviction and health outcomes, particularly for children. We partnered with our youth leaders to look at where transit opportunities are minimum, where they are robust, as just examples of how we work more directly with tailored needs of our collaborative members. We have another question that's just come in from Matthew Reeves to Karina. How difficult is it to export the data or a specific piece of data and re-upload to our own GIS maps?
It's actually not difficult at all if you have the capacity to do it. Our data can be shared either as Excel CSV files or for people who are experienced with using GIS, we can share shape files that you can add to your own maps. And it looks like we have one other question from Christina regarding data sources. Is all this data pulled from the census? So the majority of indicators do come from the American Community Survey, but they also come from other data sources as well.
Thank you, Christina, for that question.
And then,
it's okay. We're just all so excited to answer these questions. There's a question from Kumkum Gupta, whether the presentation will be available on our website. The answer is yes. We should let you know that we are recording this webinar from the start, and we will be sharing this webinar recording on our website. You can go back if you missed any portion of it, or if you want to dig a little bit deeper into the presentation. So in the, maybe if you kick us to the data portal, Karina, really quickly, I want to just emphasize, especially for those who did come on late, some of the features that I find most useful. We have this is the city profiles right now. I'd like to take us back to the portal itself, to one of the indicators. One of the features that, whichever indicator you take us to, Karina, just to give you, to look at an example, we have one already open. One of the features that I like best is where we pull out some of the key findings. So if you look here on the left-hand side of your screen, the bullets here share with you some of what we have identified as key findings or things that really stand out within the data. So right here under healthy neighborhoods, the active transportation map that's mapped by census tract, not by city, but the census tract, you see that 14% of county residents take active transportation to work. Almost half of the county census tracts have 10% or less of residents taking active transportation. The highest concentrations of residents taking active transportation are Daly City, Redwood City, and Burlingame. So this is where you can get some quick facts that we have looked at when we've looked across the data, whether it's by city, by census tract, by school district, and we have identified what might be most interesting or what stands out. So this could be and if you see some of our data are not geographically located, this is the number of small businesses in San Mateo County by sector. And because that's a county-wide data, what we've done is showcase that by a chart looking over time. And here again, in the key findings section, you'll find what we've identified very quickly to be the key findings from this. Now, you may find other areas that you find interesting or other data points, but I did want to say that you don't have to be a data whiz to be able to use this. You don't have to go deep and wide into this portal to be able to find tidbits that you might find interesting. But that's what's brilliant about this data portal is that you can scroll through, find quick tidbits, as well as dig deeper into downloading the data, comparing cities with one another, with the depth of the charts that are available. You can look at, for example, you can look at third grade reading proficiency through a number of different ways. So before, some of the ways that we had cut the data or disaggregated the data included by city or census tract or school district. But here's a place where we have it mapped by school district as well as by the economic background of the child, as well as by the parent's educational attainment. So while Karina was able to give you an overview of this, of the what's available on this, I encourage you to go in and look around for yourself, because there really is not a way for us to describe every single feature, every single data point that's available. We really need you to go in, check it out for yourself. Great, so let's give it a couple more minutes before we close out for any last minute questions. We again, want to extend a hand to work with you, whether it's around questions around with the data portal. So now that you're a little bit more familiar with it, if you want to get in, click around a bit, see if something interests you, see if you do have any questions. Please don't hesitate to connect with us. And then if you have more specific needs around research or data that you think will really help move a policy agenda that you or your community members are working with, we really encourage you also to connect with us. You have Karina and my email addresses here. Around the data portal, I encourage you to email Karina directly. I also encourage you to go to our website, gethealthysmc.org. You'll see a staff page on the About Us, where the staff members with a photograph, an email, and a background are identified. So if there's something specific related to transportation you want to talk about, not a data portal question per se, but even a research topic or some technical assistance or some policy efforts you want to work with us on, I encourage you to go to that staff page, identify the person that works on that issue, and connect with them directly. We want to partner. That's a key focus of ours, and so we really encourage you to reach out to us. We thank you. We thank Karina for joining us and sharing with us this great data portal. It's been an important part of how we democratize and share the information out broadly, tell the stories of the data that's available, and we really hope that we would hear from you in one way or another. Karina, is there anything you want to say before we close this out?
Nothing other than thank you for the opportunity to share this work, and I hope to hear from any folks who have any questions or comments or just looking for opportunity to connect and see how we can partner.
Wonderful. Thank you so much, everyone, for joining us this morning.
Thank you.
Take care. Bye-bye.